Good afternoon, and thank you for joining us. My name is Anne Marie Medina, and I am the Director of Corporate and Community Relations for the University of Arizona Health Sciences. And I am joined today by Caroline Berger, our Director in Phoenix, and Allison Otu, our Executive Director. We appreciate you coming and joining us today for Wellness Wednesdays. We respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign nations and Indigenous communities through education offerings, partnerships, and community service. I'd like to show a little video here for you about the University of Arizona Health Sciences. If it'll play. There we go.
Welcome to the University of Arizona Health Sciences. As the statewide leader in biomedical research and health professions training, Health Sciences includes College of Medicine Tucson, College of Medicine Phoenix, College of Nursing, College of Pharmacy, and the Melanenid Zuckerman College of Public Health. Together, they provide cutting-edge health education, breakthrough research, and a diverse offering of community outreach services. At the heart of health sciences, our employees, nearly 5,000 along with 4,000 students, makes us one of the top employers in the state. Our growing research and education programs are offered on 2 campuses, one at the main campus in Tucson and the other in the heart of downtown Phoenix on the biomedical campus. The University of Arizona Health Sciences is a major contributor to UArizona's well-earned reputation as one of the country's top research institutions. And each year, we receive more than $200 million in research grants and contracts, providing vital funding to help address some of our most critical healthcare challenges. We are grateful for this support, which is fueling discoveries and treatments in areas including cardiovascular disease, cancer, Alzheimer's disease, and now COVID-19. The University of Arizona Health Sciences is also in a unique position to affect change in a rapidly shifting healthcare landscape. As part of our strategic plan, we have developed a set of initiatives to reshape the future of healthcare. We are focusing our efforts on 5 important areas: next-generation education, precision healthcare for all, making wellness ageless, creating defenses against disease, and new frontiers for better health. Through these strategic initiatives, we have unprecedented opportunities to excel in education and research in more and better ways than ever before, and we invite you to join us on this journey. Please know that our dedicated corporate and community relations team is here to be your connector with health sciences. Thank you for your dedication and for all that you do to make our communities healthy.
Well, if you'd like more information, you can log on to our UAHS website or follow us on Facebook, Twitter, YouTube, LinkedIn, or Instagram. And make sure you follow me at A Medina Wildcat on Twitter. Make sure you tag those posts with hashtag Wellness Wednesdays AZ so that we can follow them. If you have a question today, just leave it in the chat. I will give Yamila time to talk, and then we will ask all those questions that you have for her at the end. And don't forget, we will be sending that post-session evaluation survey. It will also include all the links for all the information that Yamila will be providing today, along with links to the video of this recording and also links to all of our past sessions in case you missed any of those and want to catch up. So please allow me to introduce our speaker for today. Yamila El-Khayat is a medical librarian at the University of Arizona. In working as a librarian, she has been determined to increase health literacy to better serve the needs of the Latino and Native American populations, improving access to information related to the health of Native American, Hispanic, border, and evidence-based intercultural, bilingual, and culturally appropriate information. She has experience training information for clinicians, students, and community members, including health promoters, our promotoras de salud, and in addition, she serves as the communications and citizen science specialist at the network of the National Library of Medicine in the Region 4. She has a passion for health information and working with all communities, particularly those that are traditionally marginalized. So welcome, Yamila. Thank you so much for joining us today.
Thank you, Anne-Marie. It is a pleasure to be here today. I'm going to go ahead and share my screen so I could go ahead and share the presentation that I've put together for today. So let me go ahead and scroll all the way up. Thank you for such a wonderful presentation to me. I'm super excited to be here and humbled to have been invited to talk a little bit today about the importance of health literacy. As mentioned, Anne-Marie mentioned my name. My name is Yamila El-Khayat. I am a medical librarian. I serve as the Outreach Services Librarian for the University of Arizona Health Sciences Library. I do a lot of work in the state of Arizona, working particularly in rural communities, Native American communities, border communities with Spanish language materials, K-12, health professionals, and so on. But I also hold a subcontract with the National Library of Medicine, working through the network of the National Library of Medicine, Region 4 in particular, serving 9 states. I'm currently overseeing communications at a regional level in Arizona, Idaho, Colorado, Montana, New Mexico, North Dakota, South Dakota, Utah, and Wyoming. And I also do a lot of communication work at a national level with the National Library of Medicine. So in particular, I do a lot of work with citizen science and trying to increase health literacy in that area currently. So I wanted to kick off today's presentation with a very brief activity. I'm going to ask everyone to go to menti.com and use the code that's on the screen right now, 93904010, or you can visit that URL that I've put on the screen. While you are all visiting that, and maybe what I should do is put that in the chat, that way you have it. Let me share it to everyone. So you're going to go to menti.com and you will use code 93904010. So I put that in the chat, that way everybody can see that. And while you are doing that, I'm going to go ahead and stop sharing, start my share again, so that you can see the questions that I've put together for today with this mini activity. Okay, so the first question that I asked or posed for everybody was, what sources do you use to learn more about health? And you can see here that I'm going to give you one more minute to answer these questions. I've given a few options: the internet, your doctor, friends and family, and other. So we've gotten a few responses here. Just one more minute to kind of see what's going on, the trend here. You know what I should do is just to make sure we're still on time here, I'm going to keep on going, but you can see here that, oh, here we go. You can see that the internet is probably one of the sources that people most heavily use to learn about health. So the next question I have for you is, for those of you that use the internet, what sites do you use? So if you can go ahead and go to that next question, just throw in some answers here. We're just curious to hear what kind of sites you use. And this activity will stay open so that you can fill it out after the fact if you'd like to. I just think it's fun to see, live what's going on. So we've got Google, we've got WebMD here. You can see people are starting to respond with some of the resources that are utilized to search health information. Give it a few more seconds here. Oh, we've got Mayo Clinic. Good. Good. See, so it's growing a little bit. So this is a word cloud. It's going to show us a little bit more, what people are using to search information. Awesome. So you can see here we've got two sites. We've got Mayo Clinic and WebMD, and Google, which is a search engine that people are utilizing to search health information. Now, I'm going to go back to my presentation and we will kick off the presentation. Okay. So the reason why I put that up there is because I wanted to illustrate that we do use the internet heavily, or we rely heavily on the internet, I should say, to search for health information. And so what we're going to do today is we're going to talk a little bit more about health literacy and some resources that we can utilize on the internet to make sure we are getting reliable health information. When we look at health literacy, I kicked off my presentation with some statistics that I think will kind of resonate a little bit more with people. You can see that 24 million Americans are not proficient in English, which is why health literacy is a big, what should I say, a big topic. 1 in 3 American adults are in basic or below basic health literacy groups. So you can see that health literacy is an issue that affects a lot of Americans in the US. The average American reads at a 7th grade level, and unfortunately, a lot of health information is not available at a 7th grade level. It's available at higher grades, maybe high school grade levels. So that is a big concern, at least for health information professionals like myself, because what we are trying to study or look at is making sure that our communities, so our people, are understanding the information, the health information in particular, that is being shared with them. 9 in every 10 adults have a difficult time using health information that's available in healthcare facilities, in stores, and in the media. That's 9 in every 10. That is 90% of the population that struggle with health information. And then the last key element here that I saw was 53% of American adults have an intermediate health literacy level. So there is a quote here in this infographic that I wanted to point out by Regina Benjamin, which is our former US Surgeon General. She says that as clinicians, what we say does not matter unless our patients are able to understand the information we give them well enough to use it, so take action, make good healthcare decisions, or otherwise we didn't reach them. And that's the same as we didn't treat them. And this is why health literacy is a big, big topic and something that we should really take into consideration when we're looking at the healthcare system and really thinking through health information. I also found this other infographic that I thought made a really big impact, at least for myself, is 1/2 of US adults have low health literacy, which is something that we just talked about, right? We just saw that illustrated in the last infographic. 2/3 of older adults don't understand basic health information. And the cause of all this is that 4 times the patients with low health literacy, it's costing 4 times as much to treat these patients because of the health literacy level, because of their misunderstanding, maybe because they didn't quite understand how to take that medication or didn't quite understand what the therapy would be. And so things were done incorrectly. So it's costing us 4 times as much to be able to reach these patients because of the low health literacy levels that exist in our country. Patients with low health literacy are more likely to visit an ER, an emergency room. They have more hospital stays. They're less likely to follow treatment plans, and that's exactly because of the misunderstanding that exists, and they have higher mortality rates. So why health literacy is important? Because it impacts all aspects of our lives. Here's an infographic that I picked up actually from the Australian Commission. They did a really good job putting this together. It affects the navigation of the health system, right? Being able to understand how the health system works and being able to really move through the health system, right? The nutritional aspects. So being able to understand what is good and what is bad for our bodies. The organization of healthcare appointments, for instance. Paperwork, so looking at consent forms, claim forms, diagnostics, not being able to understand that. Risks and benefits, so being able to really make or take action as far as treatments goes and the risks and benefits that take into action, right, when we're doing things related to health. Medical instructions, so being able to understand medical instructions, which is something that we just really talked about. And of course, seeking support. We talked about where we look for health information, right? Many times it's friends and family, sometimes it's physicians, but we also found that the internet is a big support for people that are seeking health information. And today's focus, right? Health information is available everywhere, as we saw in our Mentimeter. What we are going to do today is we're going to talk a little bit more about one source in particular that I wanted to share with you, because any way you search this source or this information resource is going to get you reliable information. So today's resource that I wanted to share with you is called MedlinePlus. MedlinePlus is a resource that comes from the National Library of Medicine and the National Institutes of Health. One way to get there is, of course, by typing in www.medlineplus.gov, or you can go to Google, which a lot of us are familiar with, and just type in MedlinePlus and it'll be the first one that comes up. It's going to have information about different diseases, conditions, wellness issues, and of course in different languages, which is something that's very important, in particular in the US, given the plethora of languages that exists. This site in particular has all information available in Spanish, and it does have other information available in other languages, but they are currently working on trying to increase the amount of information that's available in other languages. It's going to offer up-to-date, reliable health information anytime, anywhere, and it's absolutely free. So this is definitely a site that I tend to talk to a lot of communities about, because it's easy to understand information and it'll get you up-to-date information, because it is updated 5 days a week, Monday through Friday. So the oldest type of information that you're going to get is going to be on a Sunday, because it was last updated on Friday. Now, this is what MedlinePlus looks like. So I thought I'd go through and do one search with you all. That way you can get a feel for how MedlinePlus works, and you can get an idea of how easy it is to search MedlinePlus. Now, you can go ahead and just poke around MedlinePlus and find different types of information. You can see here there's a health topics area where you can browse different health topics or different conditions and disorders and learn more about them. There's a drugs and supplements area where you can learn more about prescription drugs or herbal supplements, which are non-FDA regulated drugs. There's a genetics section, which is a fairly new section where you can learn more about how some of the disorders or diseases tie into genetics. The medical test section is also a fairly new section that has been around in MedlinePlus maybe for about a year, where you can learn more about the different tests that doctors order for us and learn what they are. So for instance, when you go to the doctor and they give you a lab test, right? It looks like a different language to us, right? No idea what they're ordering. You just go to the lab and you get it done, correct? In this section, you can learn more about what the doctor is ordering and what they're looking at. Are they looking at cholesterol levels? Are they looking at, maybe red cell blood counts, or, what it is that they're looking for? You can learn more about those medical tests in this section. And then one of my favorites that I'm not going to cover today because I can go on all day about this is the videos and tools area, where you can actually visit different videos related to different health topics, learn more about it. You can also learn about new procedures that are put in place, surgeries, tools that you can use with different communities. For instance, you can have like BMI tools in here, calculators, that kind of stuff. It's really fun to just visit on your free time too. There's also a medical encyclopedia available through MedlinePlus, where you can see articles and images from different diseases, symptoms, tests, and treatments. And they just put together a healthy recipes area. This is less than a year old also, where you can look at different recipes that have been shared for a healthy lifestyle. I do want to encourage everybody today to visit the NIH MedlinePlus magazine section on the right-hand side here. You can see the latest issue, but you can also subscribe to it and get it absolutely free, delivered to your workplace or your home. It's a magazine that comes out four times a year in English, twice a year in Spanish, featuring pop culture people that talk about some of the health topics or health disorders that have affected them in their life and how they've moved forward with it or how they have lived with it. So it's a really kind of interesting magazine to take a look at. And down below here, let me move this out of the way so you can see. Down below here, you have sections that are very specific to like easy to read health information, which goes back to some of those statistics that we talked about earlier. So these are 7th grade or lower reading level material. We've got organizations and directories that people can visit to learn more about different conditions and diseases. There's health information in multiple languages. Like I said, this section is growing on a daily basis because the National Library of Medicine is working closely with different organizations to try to put together information in different languages. And of course, there's the MedlinePlus Connect for EHRs, where MedlinePlus is currently being connected to electronic health records so that you can, look at some of the diagnostics that you've gotten from your doctor and easily access health information through MedlinePlus to learn more about what has been diagnosed. Now, what I'm going to do here is I'm going to search diabetes within MedlinePlus just to kind of illustrate how quickly and how easily you can gather information in this website. Up on top here, you'll see that I've typed in diabetes and I will click go. Of course, you can go to the health topics section up on top here and you can go to the A through Z section that's available and click on D and look for diabetes, but this is an easier way to search it. You can see here that once I click go, it's giving me a nice overview of the topic and it tells me that there's type 1 and type 2, so I can click on these and learn more about type 1 or type 2. There's also pre-diabetes that I can learn about. And of course, it links me out to 4,277 other links, almost just like Google does, right? The only difference is that these links have been vetted by medical librarians at the National Library of Medicine, making sure that it is reliable, up-to-date information. On the left-hand side here, you can see that there's also results that can be refined by different types. So like a health topic or maybe a medical encyclopedia area that you're looking for. If you're looking for external links external to MedlinePlus, it'll take you out to links like, for example, the diabetes associations, right, available, and different links like the CDC, those kind of links. There's medical test information, genetic information, once again, which is what we talked about, drugs and supplement information available related to this topic. The NIH has a lot of information also. And of course, the MedlinePlus magazine has some articles in here that you might be interested in. There are 25 articles in multiple languages that are available about this topic. So as you can see, that doesn't cover the worldwide array of languages that are available out there, but it is slowly growing. Like I said, the Medical Library, National Library of Medicine, is working to increase that number. Now, if I click on the read more here, that's available right below this overview, it'll take me to a page within MedlinePlus where I can learn a lot more about this topic. There is a basic section. There's up on top, I wanted to highlight, there is a Spanish Espanol link up on top that you can click on that will translate this whole page into Spanish for you so that you can learn more about this topic, especially for other or for Spanish speakers. And then I did want to point out that there's this section here where you can learn more about the basics. So for instance, in the basics section, you can learn more about diagnosis and tests available related to diabetes, prevention and risk factors, treatments and therapies. And of course, there's all about diabetes and how to manage it. There's a learn more section. And in this learn more section, you can learn more about how to live with this topic, in particular, related issues that you might want to be concerned about. So for example, people at high risk for flu complications, you can see here that there's complications related to diabetes. And of course, the genetics, which we talked about, how it could be passed on in your family chain, as genetics can tie or play a role in these diseases. There's the See, Play, and Learn, which is that videos and tutorials area that I was talking about. In this particular topic, it links us out to Nemours, which is a wonderful foundation with great reliable information. And it's got a diabetes movie so that parents can learn more about diabetes, in particular for childhood diabetes. There's a research section. So I do want to point out that there's two different types of health information. Right now, what we are looking at is consumer health information, which is the very basic information that ties in with health literacy. But then there is research, right, which is a little bit more sophisticated information. MedlinePlus does link us out to sophisticated information where we can learn more about statistics and research related to this topic. Clinical trials, which is a site also available through the National Institutes of Health, where clinicians, or I should say researchers, are mandated to publish their findings related to any topic that has or that has been, I should say, funded with federal money, right? So you can learn more about that in the clinical trials area. And of course, there's journal articles that have been written with findings related to this topic within PubMed or Medline. There's a resources section where you can learn more about other experts. So like I was mentioning, there's the American Diabetes Association. You can find diabetes educators available also through the American Association of Diabetes. And of course, there's a couple other listed there where you can learn more about experts that can help out, especially if you've been diagnosed with something like diabetes or a topic that you're looking for. And there's always this For You section that tries to break it down for specific populations, for instance, men, women, older adults, or just patient handouts that you can look at, especially if you're maybe a home caregiver, where you can help somebody understand a little bit better what their diagnosis is. So that is the diabetes section, but I do want to point out, if you click on the MedlinePlus logo up on top, it takes you back to the home page where you could continue scrolling and looking through some of the information that's available. So the next section that I wanted to point out is the drugs and supplements section. You can see here that if I click on the drugs and supplements section, it takes me to an area that really outlines the drug section and the herbs and supplements. Remember, the difference between these is that drugs are prescription drugs or even over-the-counter medications, and herbs and supplements are not regulated by the FDA. That's the only difference that we see here. When searching the drugs section up on top, you can see that you can click on any of these letters in the alphabet and search any drug. In this example, I'm going to search Tylenol because it's something that maybe all of us are familiar with, right? So Tylenol is something that we use for pain. If I click on T, you'll see that there's a ton of T-named medications. And I'm going to scroll all the way down to where I can find Tylenol. And notice how it says C-acetaminophen. So that tells us that Tylenol is actually a brand name and acetaminophen is our generic name. So it's actually the clinical name, or I should say it kind of, it puts together, acetaminophen is the family where Tylenol comes from. If I click on it, it'll tell me a lot more about acetaminophen, or Tylenol in this case. Why is this medication prescribed? How should this medicine be used? Other uses that are put out for this medication in particular. What precautions should I follow? What special dietary instructions should I follow? What should I do if I forget a dose? Side effects that can happen with this medication. What should I know about storage and disposal of this medication? In case of an emergency overdose, so what should we do? What other information should I know about this? And then what we just talked about, the brand names, which Tylenol is one of the many. There's also combination products, right, that have brand names, and of course other names. So you can see that this in particular is a really useful tool to make sure that when you get a prescription medication, you are getting the correct medication. You can learn more about it, what is prescribed for, dosages, maybe if you forgot a dose, those kind of things. It's a great resource to have on hand. I'm going to go back to the drugs and supplements area. And now I'm going to visit the herbs and supplements area just to kind of illustrate how this section works. If I click on the herbs and supplement, you'll see that it also takes me to an A through Z section with numbers where I can search herbs and supplements depending on their name, starting from A through Z or numbers if that's necessary. In this case, what I'm going to do is I'm going to go ahead and click on Assay here just to learn a little bit about it. And you'll see that MedlinePlus, like I said, has been vetted by medical librarians at the National Library of Medicine, who are experts at being able to identify what is reliable and what's not reliable, and links us out to sites external to MedlinePlus. So in this example, Assay is going to take us to the National Center for Complementary and Integrative Health. But you'll see that as you look down at the ones below here, there are other sites. So for instance, activated charcoal takes us to the Natural Medicine Comprehensive Database. And, as you look further down, you'll see that there are other databases also. So if I click on Assay, it'll take me out to that external link where I can learn more about the background, right? So what is Assay, where it comes from, that kind of stuff, what it's used for. So it's promoted for weight loss and anti-aging purposes. How much do we know about it? So that's what's great about MedlinePlus, is that these complementary medications that are not regulated by the FDA, we can learn more about interactions that it may have with prescription medication. We can learn more about the research that is going on. So if NIH has any recent research or any findings that they have found, you can find that here. What have we learned about it? And of course, as you go on and scroll down on this page, you'll learn a lot more about this particular topic, which is Assay. You'll notice that there are different names. There's Assay berry. Some people refer to it as a K. And then of course, it's got the Latin name related to the berry. So you can search MedlinePlus in any way, as you can see, and you will find reliable information regardless of how you search MedlinePlus. I want to thank you for today's presentation. I did make it quite brief because I do want to leave some time at the end for questions. I know health literacy is a big topic. There's a lot to talk about. So I do want to open it up for questions. I'm going to go ahead and stop sharing, and I will turn it to Anne-Marie just in case she wants to, facilitate the questions.
Thank you so much, Yamila. That was a great presentation. And, I think that so many people out there, spend a lot of time searching for really good, valid information that will help them. And this is a great resource that you've provided. One of the questions that came in was, how does our health literacy compare to other nations? And what can we learn from them?
That's a really good question. And you know what? I'll be completely honest with you. I haven't looked at the recent research, but a few years ago when I was looking into that, we actually have pretty high health literacy levels. Like I mentioned in my presentation, most of Americans in the US have a 7th grade reading level, and that is not the case for other countries in the world. So we are pretty high in, how can I say this? We're doing pretty well, but we do have a lot of work to cover to be able to get to exquisite or perfect, I should say, level when it comes to health literacy.
Great, thank you. Are there any other resources other than MedlinePlus that you would recommend if somebody is searching, or is that really the best location to go to?
That's a really good question, Anne-Marie. So I wasn't sure how long I would have. Well, I knew we'd have this full hour, but I wasn't sure how long it would take me to go through the presentation. The National Library of Medicine has really great resources, and let me search this really quickly. It has really great resources that we can utilize to search different types of information. So for instance, here, let me pull this up really quickly so I can share with you. Like I said, MedlinePlus is only one of the resources that they have available, but they do have a ton of information available in relation to, for instance, here, let me share my screen if you don't mind.
I'll go right ahead.
So they have a ton of resources. You'll see that what I did was I went to the National Library of Medicine webpage, nlm.nih.gov, and they've got a ton of resources that can be utilized. So of course, there's products and services, right? PubMed is a resource that I usually cover with researchers. So that is a wonderful resource, very sophisticated, but very complicated. MedlinePlus comes up here, right? So it's a very simple, easy to use resource. And of course, I'm going to click on all the products so that you can see the plethora of information that's available through the National Library of Medicine. You'll see here that you can search products and services related to different topics here, right? So I like to point out that there's really awesome drug and supplement. Let me search it really quickly. Drug and supplement information. It took me to D here. You'll see that there's DailyMed, which is a great database where you can learn more about the structures of different medications, and you can learn more about how medications affect the human body, right? How they work. The drug information portal is a great resource also that's available through the National Library of Medicine, where you can actually search. Say, for instance, you find pills that are lying around, right? And you're not sure what the use is. You can describe it and it'll tell you exactly what it is and what it's used for. So that's just kind of looking at the drugs and supplements. Of course, there's a lot of other sources that the National Library of Medicine has in relation to consumer health information, which is what we just covered. The National Library of Medicine has put together great resources related to stuff like environmental health and toxicology, genetics and genomics. I do want to encourage all of you to visit the National Library of Medicine's webpage and see some of the products and services that are available, because many times, you know, maybe you're not diagnosed with something, but you're just curious about something, and you can learn more about it looking at some of the products and services they put together. The reason why I'm focusing in on National Library of Medicine products at this point is because I know that regardless of how you search within the National Library of Medicine, you will find reliable information. I know that we can do Google searches, and that's a whole nother monster that maybe you and I, Anne-Marie, can talk about and do another presentation to learn more about what's reliable and what's not reliable. The internet has a ton of information. We do have to be careful because not all of it is reliable, but there is reliable information within all of that information.
Is there a way, Yamila, when you're searching, let's say somebody is Googling something and they're not searching on a great site like the National Libraries of Medicine or MedlinePlus, is there a way for someone to know if information is reliable? Is there, you know, like a citation or something that they should be looking for? Or is it better for them to search on a reliable resource first rather than just take information that pops up?
So that's a really good question, Anne-Marie. There are steps that we can take. So one thing that I like to tell people is that you have to make sure that information that is being covered within that website is accurate, right? So you gotta verify that it's information that kind of, how can I say this, relates to what has been discussed with your physician, right? So information that you already know. Now looking at the authority is going to be very important. So making sure the site that it comes from is authoritative. So looking at those endings, for instance, .coms are companies usually trying to sell you something. We've got organizations which are .orgs, right? Which are usually going to have reliable information. And of course, the National Library of Medicine is a .gov. That's going to be information that comes specifically from the government, but it is federal dollars that have been put out specifically to try to increase our health literacy within our communities across the US, and information that has been put out so that we're sure that we're looking at reliable information. Of course, there's other things that you should look at. For instance, the currency. So you can look at those websites and make sure that it was last updated recently, right? So it's not like old information. And of course, making sure that the coverage is good coverage. You know, is it covering all the FAQs, the questions maybe that are put out? Does it cover the history of whatever it is that we're looking at? So really taking into consideration those things are going to help us differentiate good information from bad information that's available on the internet.
Yamila, this has been really, really helpful. And I wanted to ask, you know, I'm sure that there are some folks that might say, well, I've found this information, but I'm not sure about it. Are they able to contact you or someone at the University of Arizona Library, Medical Library, to make sure that they're finding the information, or to get some guidance on where they should look?
Absolutely. And this is exactly why I had that thank you up. Let me go ahead and put my PowerPoint back up. I do want to put my information out there, although I do have a lot going on with work. I am more than happy to help anybody out there that may have questions about information they have found, or maybe even a health topic that they're not sure as of where to visit or what to find, or what to look for, I'm sorry, when looking for that health topic. So you've got my email up here on this slide. It's yme@arizona.edu. I am more than happy to make myself available to help out when those questions come up.
Wonderful. And we'll make sure and share that in the follow-up email. Yamila, thank you so much. I really appreciate it. It was so great seeing you again. And thank you for joining us today. So
thank you so much for having me. It is a pleasure to be here. I always like talking about health information and health literacy, Anne Marie. I wanted to make it brief because I can go on forever talking about this, but I do want to thank you all for attending. And if you have any questions, feel free to contact me.
Thank you so much, Yamila. We'll talk to you soon.
Thank you.
So, thank you all for joining us. And I just wanted to remind you that we will be having our next session. I've got to see if I can get my screen to move here. Let's see. There we go. On November 3rd, we are going to be not celebrating, but honoring National Alzheimer's Awareness Month. And we were very, very lucky to be able to get Dr. Roberta Brinton, who is the director of the Center for Innovation in Brain Science at the University of Arizona Health Sciences. And she is doing amazing research on Alzheimer's. And she is going to be talking about recognizing the signs and symptoms of Alzheimer's and talking about how it affects the brain, and also talking about some new therapies that are being developed by the University of Arizona researchers to reduce the cognitive function in early stage patients. So please join us for that one. Again, on behalf of all of us here at the University of Arizona Health Sciences, we appreciate you joining us today. And as always, please bear down, vax up, and mask up. Thanks all. We'll see you soon.